I am Matilde Leonardi, the co-leader of the work and chronic disease work package on employment and chronic diseases. And together with Michele Engemann, who have been working with me from the Carlo Besta Institute, we are welcoming you to the roundtable discussion. And we will be pleased to discuss items that are helping us to launch the workbox that today it's open. Now the press release has gone out, so you will find, if you go on the web, the workbox in all the different languages. It's available in PDF as well. On the web page is available for your smartphone or for any use. And it is the first time, I would say, that you find a instrument already available at the moment of its launch in so many languages. And I wish to thank all the partners and all the collaborating partners who have been for these 3 years working with us in developing this. It's now my pleasure to give the floor to Jana Lindström to introduce all the panelists. Thank you, Jana.
Thank you, Matilde. So, as you probably know already, if you were here during the previous session, that my name is Jana Lindström and I'm the co-leader of this work package and was leading the development of the toolkit. And today we are going to have an excellent group of panelists to discuss about the issue of employment and chronic conditions. And the panelists are Kari Reijula from Finland. Then we have Romolo de Camillis from Italy. Then we have Jesus Carrillo Castrillo from Spain. And then we have Katie Gallagher from European Patient Forum. So first, I would ask all the panelists to introduce themselves and explain a little bit about how they are linked, how their work is linked to this topic of this panel. So we will start from Kari.
Hello, chairpersons. Regards and hello from Finland. Behind me you may see one of the lakes, one out of those 100 or 200 thousands of lakes in our country. I'm professor in occupational health, so it means teacher and researcher at the medical faculty of Helsinki University, where I act as the vice dean of the faculty as well. This is the medical faculty in Helsinki is the largest medical faculty in Finland, and we are closely collaborating with the University Central Hospital. I happen to be a member of the board of this central hospital, University Central Hospital, and I'm carrying out the clinical activities as well. My topic of interest in occupational health and medicine. And my dearest topic of research has been for quite a long time. It's focused on adverse health effects related to smoking and tobacco and nicotine addiction. And I've been lucky to be able to participate and involved with establishing strict tobacco legislation in Finland, one of the most strict ones in Europe or in globally as well. Especially related to smoke-free workplaces. In 1995, Finland was one of the first nations to launch the very strict ban of smoking in workplaces. And in 2000, the restaurants were actually taking into that legislation as well. It's very interesting. I'm very interested in collaborating with you with this issue. Thank you.
Thank you, Kari. And then we would have Romolo.
Welcome to you, and thank you for your invitation. I am Romolo De Camillis from Italy, acting General Director for Labor Condition and Industrial Relation at the Ministry of Labor and Social Policy. My work is directly connected to these topics because we manage at the national level the working condition for the private sector. So we are every day involved on these items. Also, I am a member for Italy In the board of the European Labour Authority is a new agency established last year from the European Commission, is another body to improve equal condition for workers in Europe. And so I hope to can share this experience and this tool also within my colleague in the board of European agency. Thank you.
Thank you. And the next one would be Jesus. Please, the floor is yours.
I am responsible for research and development in the public health system in Andalusia, in the region of Andalusia. But previously I was the head of the Department of Promotion of Health and Safety at Work in the same government, the government of Andalusia. So I am used to participate in programs and interventions to improve workplace health. Regional government of Andalusia has been working in these initiatives for a long time. We are very happy to join this project, this action of CHRODIS Plus, and we have participated in 2 work packages. And I would like to highlight the role of the prevention services, at least in Spain, the occupational health services that any enterprise has to provide their employees, so they can be an important actor in this implementation and this promotion of health at workplaces. We will talk later on. Thank you.
Thank you. And finally, we have Katie from EPF. Katie, please.
Thank you, Jana. I hope you can all hear me. Thank you, Matilda and Jana. Hi, everyone. It's really a pleasure to join you and respected colleagues for this really important discussion. I just also wanted to take this opportunity to congratulate the leaders and partners of this work package for the excellent work, and it's been a pleasure to be part of it for the last few years. So I'm Katie, and I work as Senior Policy Advisor at the European Patients Forum. My role is really to shape and contribute to the development of EPF's policy and advocacy work. And I'm specifically responsible for our strategy on universal access to healthcare, but also social policy. So for those of you who are not familiar with my organization, the European Patients Forum leads patient advocacy in Europe, providing a cross-disease perspective from a wide patient community to the policy-making process on issues which have a direct impact on patients' lives. We have 75 members, and they represent both specific chronic disease groups at European level or our national coalitions of patients. And our focus on this theme is really to advocate for equal treatment and better inclusion of people with chronic and long-term conditions in the workplace, and to promote the development of EU and national policies that tackle discrimination faced by people with chronic conditions in employment. While some, to give you a little bit of background to start the context of this discussion, while some people with chronic conditions cannot continue their professional activity due to their health condition, many actually continue working or wish to do so. And it's with adequate support that those who wish to can work. However, patients do report feeling misunderstood, excluded from their working environment, or even discriminated against in the labor market, either when searching for a job or in their current job. And so I think just to bring it back to the theme, I'll finish on this, to bring it back to the theme of today's discussion, and in the context of this joint action, intersectoral action on health, and that's what we're talking about with this work package, and a systematic health in all policies approach really remains a big challenge in Europe. And collaboration between the health and labor, but also other sectors, is really required to achieve integrated, coordinated care for chronic diseases, but also to eliminate inconsistencies and address policies and actions affecting health outcomes undertaken by sectors outside the health sector. So This also needs to be accompanied with information and training and raising awareness, and the workbox really addresses these concepts very well. So that was just in short to start, and I'm really pleased to join in the further discussion. Thanks, Jana.
Thank you, Katie. So now I am even more convinced that we have an excellent group of different perspectives on the issue on board. So just a quick round of questions to begin. So what do you think is currently the most pressing challenge related to promoting the well-being and health at work and the inclusion of people with chronic conditions? So maybe now we have Katie here. So maybe Katie, you could now, you already touched this a little bit, but continue just briefly.
Sure, I did. Thanks, Jana. So yes, I was talking about this this challenge of intersectoral action on health. So that's really an important element. I would say another very important element is a mindset change and a cultural shift that are needed to address the barriers that people with chronic conditions face in the workplace, ensuring well-being at work. In the workplace, people with chronic conditions often face low levels of awareness about living with and managing a chronic condition from their employers. Employers often underestimate the abilities of people with chronic conditions to continue working, resulting in stigma, while work can actually be very positive for the recovery process of a person with mental ill health, for example. And there may be also unfounded concerns about costs, productivity, and absences. So this mindset change is really an important point. I would also say that these tools, both the training and the toolkit, if implemented well, have a real potential to contribute to the creation of more supportive working environments for people with chronic conditions, resulting in a hugely improved quality of life for patients that minimizes the negative financial impact of chronic ill health, the risk of social exclusion, and positively contributes to their mental health. So I'll just finish with the fact that, coming back to my first point, with a concerted action from a variety of stakeholders from different sectors, driven by political incentives at EU and national level, we can really contribute to help normalizing the view that actually discrimination and exclusion in the labour market is not a patient's problem, but a societal problem. And with the right kind of support, as proposed by Work Package 8, many persons with chronic conditions can stay active in the world of work. I'll stop there.
Thank you, Katie. That was not only the problem, but also the solution you provided. So how about Jesus? What would you say in your perspective? What are the most pressing challenges at the moment?
Well, from my previous experience, I have I would like to bring up the challenge of reforming, of adapting the framework directive. The framework directive is very clear in terms of the occupational health and safety conditions for workers, but it's not considering the workplace health promotion at all. And I think it would be a good thing to reform, to improve this framework directive, because as I said before, the preventive services can expand their activities to the health as a whole, not just the evitation of illnesses or accidents. This could be helped also by public institutions providing clear technical guides of how to do this adaptation in workplaces for chronic workers. Because at least in Spain, the soft law, we call the soft law in terms of standards or technical guides, could be very useful for enterprises to know how to adapt those workplaces for chronic workers nowadays.
Thank you. So, Romulo, would you like to add something to this? What is your opinion?
Oh, yes, thank you. I agree with Katie regarding a cultural challenge that we have to improve in our action. because we know that an inclusive workplace is a better workplace. We have to stress the relevance of reputation and the possibility to adopt some measures to support concretely these persons. We know, from my example in Italy, we have some instruments, some concrete instruments to have a tailor-made working condition for some workers if they have some disabilities or some chronic disease. And so I think that we can work to expand this framework for all the workers in all the sectors, public, private, small, big and medium enterprises. And so I think that we have to stress this point, a cultural challenge for all of us, for all the actors in all the sectors, and so with the full involvement of social partners also for our national experience. Thank you.
Thank you very much. And then, Kari, what would be your problem and maybe also the solution to it?
And thank you, Jana. Very good points before. I would like to raise up something which I think I know pretty well, and this is the occupational health services. I'm responsible for the occupational health training among doctors to become specialists in medicine, and how the process of occupational health acts in real life in workplaces. And the first question is how to assess and support the workability among those who have the chronic diseases. And there is so much to do in that field. First of all, how well the specialists are trained to carry out the proper and evidence-based assessment of workability among those who have the chronic disease, whatever the disease is, and to give the assessment, and after the assessment to carry out the actions which are needed for this particular individual, to make sure that her potential is used as well as we can, and how we adjust the work tasks according to the needs of this particular person. And to have this in a whole package, we need not only the patient or the worker with the disease and the doctor and the system to carry out the assessment, but also the workplace to carry out the actions which are needed, and how well the communication between the professionals and the workplace are carried out, and how convinced the one who has the money and resources to carry out the actions understands that what we have to do with this particular individual, but also with the workplace in general, with the work organization, so that the outcome would be the best which we can do. And so this needs training, this needs proper models of actions and tools, and certainly the communication between the workplace and the resources and those who say what we should be doing. And I think that is the one which really is one of the most important things to be tackled.
Thank you, Kari. So indeed, this highlights that there are so many actors that need to work together to make employment life healthier and more inclusive. But now I give floor to Matilde.
Yes, thank you. Because I think that we are living now a very peculiar situation globally. And I think that within the framework of the pandemic that we are living, I think that the issue of having already a chronic condition and the employment is playing a major role in all the debates of all the political arena. And this is why I'm asking you, how in this particular moment do you see that the inclusion of people with chronic conditions, diabetes, cancer, headaches, or even obesity, hypertension, name one. How do you see this and inclusion of people with already condition and keeping at work? That is also the other difficult point in these moments where work is becoming a dramatic arena for discussion. How do you see that inclusion is possible, and how actions can be taken for those who already have chronic conditions in this labor market? And I will start, on the contrary, from Kari and going back to Katie, starting from you, Kari.
Thank you, chairpersons. And then coming back to think this issue as a medical doctor in real life, when I'm seeing the patients who have the workability problems due to the chronic diseases. First of all, somebody was mentioning, was it Katie who was mentioning about the mindset change which is needed throughout the macro society to understand that we need all the workforce which we have in our hands. Especially in Finland, we are running towards the lack of people to carry out the tasks. We need everyone, even those who have the disorders, to support the workability, to come back to work again and carry out the tasks which are needed. We do not have too many people to carry out the tasks. So again, the macro mindset change to understand that we have to support the workability as well as we can, and use all the resources, all the sources which we have in our hands to improve that the workability, to bring people back to work, and then adjust the work site so that the functionability and the workability meets the needs to be carried out in the workplace. And the change in mindset, then the second thing is that how well the different operators they are acting, how well the workplace takes care of the individual and helps the occupational health professionals to carry out their task. How much they can give the resources for the occupational health to carry out the tasks, and how well trained the occupational services are for these needs. I think this is very important and needs everybody to be involved.
Thank you, Kari. And now I move to Romolo, that has the perspective of a government who is dealing now these days with people with chronic condition and employment. How do you think that inclusion can be kept?
Thank you, Matilde. Well, I want to be optimistic because I think that the pandemic give us the opportunity to work for new approach, to create a new operational models for our workplace, and also to improve a new inclusion of people and of workers. Before somebody says that we have to see a new approach, a people care, no workers care. So I think that the pandemic can give us this opportunity to translate in the workplace a new model, a new approach for people care. And so if we discuss about people care, we don't have categories. We have some people that are in the same time workers. They are men, women, and so they work in the public sector or in the private sector. They work in the big cities or in small centers. And so I think that in this time, we have to work to stress new models. For example, beginning from the smart working. In Italy, during the pandemic, in the last 8 months, we observe a large use of smart working in all the country, in all the sectors. And so we are evaluating this model. We are evaluating this new instrument And so we hope to receive from this period, from this analysis, good elements, good options, good inputs to work with our colleague in other sector, and I repeat, with the social partners, to put in practice new models and new approach.
Thank you so much. The same perspective from regional point of view, Dr. Jesus, please.
Well, I am also optimistic, and I will share with you, probably it's the same in every country, with the COVID, most enterprises and most public institutions are dealing with the teleworking, with the idea of having the worker at home, connected and participating in the enterprise, in the projects, without the need to be in the enterprise. And that brings an opportunity, I think, for those chronic workers that can be very useful with their experience, with their knowledge from their houses, without possibly some problems with the health issues with the COVID. At the same time, we have to be very realistic about the different actors that we have in this system, because health as a whole for the individual is one concept, but we have different sources to cover the non-health issues. We have problems at work with systems of mutuas or systems of providing healthcare for the workers, and also we have the non-health issues when the worker is at home, when he's in a private life. And at the end of the day, at least in Spain, all of this is covered for the public sector, and the enterprise has little or few incentives to promote and to develop a better health for the workers, because at the end of the day, the effects of the non-health is going to be covered by the public. So we have to think about that.
Thank you. Kati, your comment on this.
Thanks, Matilda. Well, I would say from our perspective, implementing policies for workplace adjustment and accommodations, in particular, building on existing good practices, ensuring supported employment in that sense, in the current context and economic crisis, will be even more important, as you said, Matilda. On a separate note, this is also important in terms of ensuring the protection of people with chronic conditions from COVID. As the pandemic and containment measures also continue, it's really important that Europe prevents the current health and economic crisis from developing into a social one. We've just closed a survey on the impact of COVID-19 on patients, and the impact COVID has had on the employment of people with chronic conditions has also been included in the questionnaire. I don't have the findings for that yet, but they should shortly inform, let's say, EPF's recommendations in this context. As an already more vulnerable population, if I can put it that way, just to give you some information, on average, the incomes of people with disabilities are 12% lower than the rest of the population. And in some countries, the incomes can be as much as 30% less. It will be extremely important to prevent further poverty of employees with chronic conditions due to partial or unemployment caused by the COVID crisis. So I come back to that first point, that really implementing policies for workplace adjustments and accommodations will be really very important in this context.
Thank you so much. Stay there, because you are the first of my next question. Just to tell you that while we were developing the training tool, smart work 3 years ago was still something that was seen as quite rare in many of the small and medium and even in the large enterprises. And as long as we were developing the training, we entered into the pandemics, and then smart work became the #1 reasonable accommodation to adjust to the global pandemics, but not all the industries and the enterprises were ready. So we also see that there might be some issues related to isolation and stigmatization that remains, and women and young people are those who are mostly affected. having chronic diseases by the situation of smart work. So it is good for protection, but sometimes it could become if managers are not well ready to act. And this is then where it comes our 4 question. And we are now going to the employers. And we are asking to all of you, what are, according to your experience, the best ways to motivate employers to do actions, both for invest in well-being and in prevention, as well as to try to make the workplace a more livable and more active place for the health of all the workers. I mean, how can we convince them? There are some examples during CHRODIS. We have been working with the Lombardy at Work, which is an initiative that we have been implementing in Spain, in Andalusia, that is trying to give incentives to the enterprise so that they do actions to change their, let's say, lifestyle, to change the life, improving the life of workers. So, starting from you, Kati, what are the things, the best way to motivation of employers, in your opinion?
Thanks, Matilda. Before I go to how to make that business case, let's say, for inclusive and healthy workplaces, I just want to inform everyone that actually patient organizations are really extremely active in this field. And patient-led initiatives relate to gathering information, but also carrying out research to better identify the obstacles and solutions, as well as raising awareness and advocacy for the rights of patients in the workplace and combating that experienced stigma and discrimination and advocating for the inclusion. Some patient organizations have also developed guidance for employers, and some of these are our members who will probably be joining this this meeting today. In 2018, EPF published a collection of patient organization initiatives to really promote the patient-led actions and promote EPF member action on this topic and the take-up of existing material. So that's just in the context of this work. So how to really convince the employers? Similarly, also in 2018, in consultation with our membership active on this topic, we developed a digital leaflet for employers, which makes the business case for inclusive workplaces, speaking with that kind of language. I'll give 3 as an example. Inclusive workplaces clearly have many benefits for employers, such as preserving and retaining skilled staff, sparing additional costs of recruitment and training. A second is inclusive workplaces have also shown to result in higher motivation and commitment of employees, resulting in better productivity. Something that is not often thought about and is not used enough are support schemes that are available to employers, which can provide funding also for small companies that might not have the funds to do so, towards the costs of modifications or special equipment that will allow a person to take up a job or to remain in employment are also attractive methods. The workbox, developed by Work Package 8 is really comprehensive, concrete, state-of-the-art and ready to use. And I think that's really the key of its success. And it really proposes that A to Z method and process of how to create and foster supportive and healthy work environments. I think it was said in the video of Jana and Eva, many things that can be done with limited resources, and even the smallest measure can really make a difference in creating the supportive working environments for people with chronic conditions and improving the quality of life and job satisfaction of employees. So that's kind of in a nutshell what I would say from our perspective, Matilda.
Thank you. In asking Jesus, Romulo, and then the Kari to reply, there is also a question from the audience that is asking whether there are problems by the difference in social regulations that can hinder the implementation of some actions that are also expressed in the training. And then we have a question from India that I think we replied in the previous round, saying how workforce with chronic condition are treated. But going back to how we can incentivize the employers, Jesus, from you, a reply.
Well, I agree totally with the business case orientation. employers are used to understand what a business case is. But at the same time, I think that we have to look up the unions. Worker unions can have an important role in this motivation for employers. If the employer sees this kind of health promotion programs as a tool to have a better relationship with the workers, and the worker unions enforce that the agreements with the employers in terms of the working conditions can be adding this kind of promotion of the conditions for the chronic workers, of the health promotion, could be a good way to do it. Because at the end of the day, there are a lot of things that administration or enforcement cannot do, because it's very difficult to cover all the enterprises. But in the micro level of the enterprise, the worker unions or worker representation can be the incentive to do things, even if the business case is not enough.
Thank you so much. Romolo, your opinion, please.
Yes, thank you, Matilde. I think that we have a multilateral approach if we want to have a good results. First of all, yes, our experience in Italy says that incentives can be one solution, but not the only. We have to put in place, I think, some instruments. For example, we have to improve the reputation of employers to adopt these models. And in other way, I think that we have to propose to the employers every time concrete solutions. Because with the concrete solution, they can adopt the good choice for this our objective. And after, I think that we can to promote the social dialogue on these specific issues, because among social dialogue we can support all the actors, so the institutions, so the employers, and also the social partners, to introduce in the workplace these new models and these new choice for inclusion of these workers.
Thank you. Kari, you already mentioned in your introduction that you were one of the actors for the legislation against smoke and tobacco. So is it legislation the way to convince employers, or do you think that there are other means that you can share with us?
Thank you. Are you reading my mind? I put the number one legislation, which is dealing with the occupational health services throughout the nations. If you have the legislation where the company has to provide occupational health services to the employees, that's the beginning. But it's only the beginning, not the thing which is getting to the best results. It's the trained professionals carrying out the actions by using evidence-based science to find out which are the most cost-effective actions to be carried out among the people who have the diseases and whose workability should be supported and maintained. But the legal issues are something which has to be there behind. And then I mentioned, and I should have mentioned that with the COVID issue, what we have learned, for example, in Finland, fighting against the COVID, and we have succeeded pretty well, as you may have recognized, is the evidence-based science which has to be there. We can think about facts and fictions, but use the evidence-based science and facts and research to develop and test, and then use the things or the actions which give us the best results. And this is the thing which which have to do with the chronic diseases and workability issue as well. Occupational health services has to convince the employer, the companies, that this is cost benefit to do as we say, and let's do it together. And let's motivate the people in this company, both the ones who have the disorders and those who belong to the work organization, and do it together. Give the rules how to carry out the actions, whatever are needed. So legislation and then the evidence-based actions, whatever they are. And the third part is to put the healthcare services in proper order, and they are not in every country today. I mean that the basic healthcare, carrying out the prevention with the best tools and health promotion, where the high number of individuals are connected to the basic healthcare systems, including the occupational health, and then communicating between the basic healthcare with the specialized medical care. There is a big gap between the basic healthcare and the specialist hospitals, which should communicate much more than they do together for the people whose chronic disease has to be checked in proper order, and give the best treatment which is needed, and then come back to the situation in real life where you have to carry out your tasks under the cover of occupational health services. So those three: legislation and the evidence-based science, and then the best arranged healthcare system from basic health to specialist medical care.
Thank you so much. Within our work package, we had the National Institute for Cancer from France. They also had very good examples on how to involve the employers, creating the club of enterprises. So also sharing good practices between employers could be also a motivation. And I think that the French experience was really one of those that we took for evidence-based, but also practical experience that we could share with other countries. And that was very, very good. And I now, with pleasure, give the floor to Jana for the conclusive round. Thank you, Jana.
Thank you, Matilde. So excellent points have been made during this discussion. As I have been taking notes, and I can actually see a new project forming in front of my eyes, and you are all invited to take part in this. But last but not least question on our list would be, how could you support the uptake of the CHRODIS Plus workbox? Now, very quick round because we are running out of time. But so, should we start from Kari now?
Thank you, chairpersons. I happen to belong to the board of International Commission of Occupational Health, and I would like to collaborate with all of you. So the occupational health throughout the nations globally could be taking part in improving the actions, whatever we are doing. Research is needed, and so research and training is something which we can work together with the faculty, but also with the multi-professional professional actors all around the world. Thank you.
Thank you, and then Romola.
I hope to support in my daily work with some stakeholders, with some other actors in the private and public sector at the national and the European level, with my colleague in the European Labour Authority in Bratislava. I hope to publish, if there is an Italian version of the toolkit, on the website of our ministry. Is a website very consulted every day, and so I hope that this can be a good opportunity. And after, I hope to promote and to support when in some occasion of dialogue, of social dialogue, and of meeting with the other stakeholders at national and European level. Thank you.
Thank you very much. And then Jesus.
Well, we are going to use this toolbox, this workbox, in our network of enterprises that are promoting health at work and disseminating these tools also with our social networks. We have a good relation and a lot of relationships with Latin America, where a lot of countries are using the materials that we are publishing in our websites and so on. So this is the way we are going to use the workbox.
So it really pays off that we managed to make all these language versions. So it's so important for the dissemination. And then finally, Katie, you have the last word on
Thanks,
this.
Jana. I couldn't agree more. Translations are so important to ensure maximum impact and uptake. And I would actually argue that now is the most important stage to ensure that impact and that widespread uptake. And the CHRODIS Plus Joint Action actually presents a unique opportunity in this regard. I just want to point out one thing. In a survey that was carried out by EPF's youth group last year, 37% of respondents actually selected trainings for management level employees on how to manage people with chronic conditions in the workplace as the most needed measure to increase employment among young patients. So these findings really point to the relevance and value of the tools produced by Work Package 8 launched today. In a first instance, EPF will do its part in promoting the workbox to civil society, and we've actually developed a video and a brochure with this target in mind. But in our policy and advocacy work, of course, the recommendations of Work Package 8 and the tools will be embedded in that. And actually in 2021, drawing lessons from COVID-19 pandemic and against the backdrop of the changing world of work, the European Commission intends to come forward with a new EU strategic framework on health and safety at work in the context of the European pillar on social rights. So EPF will make sure that we take this opportunity to highlight the recommendations coming out of this work package. Thanks, Diana.
Thank you very much on my behalf to all the participants. And now I give the final word to Matilde.
Thank you so much to all the panelists for their presence, their commitment. We take it for sure, but let me close by thanking all the different partners and collaborating partners who, together with myself and Jana, have been working to come out today with this workbox. We would have not been able to do without the collaboration of so many colleagues from organization and partners. And I wish to particularly thank two people here. One is Eva Rantala and one is Michela Engemann. They have been supporting Jana and myself along all this pathway, and I think that they deserve a virtual applause. And I also want to share with all of you a virtual applause for those who have been working with us for allowing now to have a tool that can be used from today, available in PDF on the website of CHRODIS, and also available as a web tool in 10 languages. So all the languages you need for disseminating in Italy, in Spain, England, in Finland, in France, it is there. You can use it. It's free. It's available. It's downloadable. There are all the explanations to be ready to use from tomorrow. Please use it. And I wish to thank Jana for these 3 years of work together, and all of you for staying with us this morning. And now we have lunch break. So thank you from all over the world as you're listening to us from many, many countries. Thank you for being with us this morning. And see you in the afternoon for the second session of the CHRODIS Plus final conference. Bye.